All right, welcome everybody to our Central California Legal Services Clinic on access to healthcare. We are just in the process of getting live on Facebook and admitting everybody into the Zoom meeting. So bear with us for just a moment. All right, welcome again, everybody. My name is Andy Kuchera. I am the pro bono manager at Central California Legal Services. I'll introduce our other presenters in just a moment. But today's clinic is on access to healthcare. So if you are looking for information about access to healthcare, you are in the right place. Just a little bit of information to get us started about Central California Legal Services. We are a civil legal aid nonprofit law firm, and we have a 6-county service area, including Fresno, Tulare, Kings, Merced, Tuolumne, and Mariposa counties. And I believe our health team serves some additional counties, and our presenter will tell you about that in just a moment. So we are live on Facebook today, and we are also hosting this meeting on Zoom. So welcome, regardless of where you're joining us from. I'll give you a little bit of ground rules about the clinic and our Zoom and Facebook. If you are in the Zoom meeting, your camera has been turned off and you've been muted. And to avoid disruptions to the clinic, you will not be able to turn your camera on or turn your microphone on. But you can communicate with the hosts by typing questions into the Zoom chat box. So your Zoom should have a little button on the bottom that says chat, and if you click on that button, you can type questions into the chat box. And we'll have a portion of the clinic towards the end that we're reserving for questions and answers. So if you have questions, we'll try and get those answered. And so just go ahead and type those into the Zoom chat box. We're also broadcasting on Facebook Live today, and so I'd like to introduce our legal secretary for our pro bono program. That's Jennifer Ramirez. And Jennifer, do you want to say hello and what you'll be doing today?
Hello, I'm going to be monitoring the Facebook Live, so any questions that get asked on Facebook in the comments, I will be asking Brandi at the end during the Q&A.
Excellent. So if you are watching on Facebook Live, then you can ask questions by just typing them into the Facebook feed, and Jennifer will be monitoring that. Last about our clinic today, today's clinic is a legal information clinic. So we'll be providing you with legal information that's different than legal advice. Legal information is simply information about what resources are available to you. Legal advice is the application of that to your specific situation. And if you have a legal problem or need legal help, please do call Central California Legal Services, and the number will be on the bottom of the slides, and I'll post that in the chat box in just a moment as well. So just a reminder that nothing in the clinic today creates an attorney-client relationship between you and Central California Legal Services. But we are a resource for those that are eligible. So if you do have a legal problem or need assistance, please do give us a call. So that is all I have by way of introduction. So now I would like to introduce our presenter. Our presenter today is Brandi Snow, and Brandi is our health consumer team staff attorney. And Brandi, do you want to take it away?
Sure, thank you very much. My name is Brandi Snow. I'm an attorney advocate in the Central Valley Health Consumer Center, which is a project of Central California Legal Services. I have been licensed as an attorney since 2004 in Tennessee and in California for 4 years. And what I do, along with the rest of my team, is help people who are having any kind of health consumer issue. And that's going to cover not only the things we talk about today, but also medical billing, also estate recovery, any kind of consumer issue you can think of that touches on the health realm. We try to help with that. And if we can't help, then we direct you somewhere that can. A couple of other things that I wanted to put out into the world, as was mentioned, this is not legal advice. It is legal information. These are things for you to keep in mind if you're trying to do some self-help, or if you just want to know if there are options. But it's also not medical advice. And that's important for this one in particular, because we're going to talk about different ways to access care. And I really want you to know I am not a medical expert of any kind, and I don't want anything I say to be construed as telling you when you should go to the emergency room versus urgent care versus your regular doctor, when you have time to wait to see a doctor. Those are not things that I can advise you on. What I'm wanting to give you information about is how to do all the things you have the option to do. So I want to start by telling you a little bit about our Health Consumer Center and our philosophy, which is that we think getting, keeping, and being able to use your health insurance is essential to keeping you and your family healthy. If you don't have insurance, it's much harder to keep your family healthy. If you can't keep your health insurance steadily and consistently, it's much harder to keep your family healthy. And if you have insurance, but you can't use it, either because of billing issues or because of access issues, then it's not doing you any good. So those are the three areas that we really focus on. What we do is provide no-cost consumer assistance to people who need our help. And what that means is you never pay us. For one thing, that's kind of the important thing, right? If you need assistance and you don't have the ability, you don't have the means to call a private attorney, or you just don't know what to do next, call us. We are not going to charge you. We'll help with health insurance eligibility, access to healthcare service issues, medical debt and billing, Medi-Cal estate recovery. Like I said, any health consumer matter you can think of, we have some way we can help. It's important for you to know before you call who we can help, but you can always call, even if you don't fall into this category. And I think that's the one thing I want everyone to take. If you take nothing else from this presentation, if you don't know, call us. We are always here. We are happy to help. If we can't help you, we'll help you find someone who can. We have the ability to directly assist U.S. citizens and legal permanent residents. There are some others with legal resident status who we can help, and some we can't. It depends on what kind of immigration status you have. So call us, ask. If we can't help you, we'll help you find someone who can. There are not income limits for the healthcare consumer team. We are able to provide help or direct you towards assistance regardless of income. The phrase consumer assistance, which I keep using, can mean a lot of different things. First and foremost, it means we're going to tell you what your options are. A lot of times a client will call us and say, here is the problem I'm having, and I don't know if it's fixable. I don't know how to fix it. I don't know if I have any options. What can I do? And we can help you figure out what your options are. We will sometimes give advice on how to handle the matter on your own. If you feel capable of doing that, if you feel comfortable doing that, then you might only need us to tell you, hey, here's who you should call about that. You might also need us to make phone calls or requests on your behalf, either because the situation is more complicated or you're less comfortable. You might need us to write letters on your behalf or help you file grievances or appeals or complaints. Those are all things that we do under the right circumstances. One thing that we do ask, because of being a legal aid organization and having limited resources at times, is we're generally going to ask you to partner with us in how we assist you. So if you're capable of making calls on your own, we might say, hey, make these calls and then call me back and let me know what happened. Sometimes that helps us to be able to help more people at the same time. But we're never going to ask you to do something that you're not comfortable or capable of doing. Here's a list of things that we sometimes get calls about, and they're things that we actually cannot help with. We can't help you file a medical malpractice case. We can't help you file a workers' comp case or a bankruptcy case. We can't help you file a personal injury case. Sometimes there are things you need help with that touch on those things a little bit that we can help with, but actually starting a case, those are areas that we are not able to help with. As Andy mentioned earlier, the Health Consumer Center actually works for more counties than the rest of CCLS does. And that's because of where our funding comes from in our grant process. But here's a list of counties where we can help. Okay. One thing I want you to keep in mind, though, is that there are healthcare consumer assistance alliance members all over California. And that means that if you're not in one of these counties and you need help, and our number is the one that you have, it's okay to call us and we can send you to the right place. I'm going to give you two sets of information today about access to healthcare services. One set of information is the stuff we always do. Day in, day out, last year, next year, 3 years ago, 3 years from now, ways that we help you access healthcare services when everything is normal. And then the other set of information is going to be things that we're doing now and information you might need because we're in a public health emergency with COVID-19. So right now, we're just going to talk about, these are things we always do. COVID, no COVID, not related to COVID, nothing to do with COVID. We would do this if it was 5 years from now, we hope, 2 years ago, 6 months ago, whatever the case may be. We help you identify options for getting services you need. So if a consumer calls us and says, I need this treatment or this medication or this surgery that my doctor says I need, and my my health insurance just won't cover it. Okay? We're going to help you identify what your options are for getting it. There may be community resources for getting it. There may be other ways to see the doctor, to get coverage for a prescription, and we can help you identify all of that. We may have to help you file a grievance or an appeal with your health plan. If your doctor says you need something and your health plan says they're not going to cover it, then that might be something that we have to help you with in terms of a grievance or appeal. And if that doesn't work, then there is a process called the Independent Medical Review with the Department of Managed Healthcare in California that lets us basically say, we're going to go over your healthcare plan, your insurer's head. We're going to go over their head. We're going to say, hey, California government, Department of Managed Healthcare, this person's health insurance won't cover what they need. So we would like an independent medical review. And I'll talk about that some more in just a minute. Okay, the Department of Managed Healthcare is a government agency that we're fortunate to have here in California that is there solely to manage healthcare plans and to help consumers. So they have a Consumer Protection Help Center. They license healthcare plans and make sure that those plans are complying with state law. If there are rate changes, they have to review that. They track complaints, and they can take enforcement actions, legal action against a plan that violates the law. Okay, so this is some information about their Consumer Help Center, sorry. And the number of people they've helped over 2.3 million Californians resolve complaints. Their services, just like ours, are free. Everything you tell them, just like everything you tell us, is confidential. And that process I was telling you about, independent medical review, over the last 3 years has resulted in about 62% of people receiving the service they needed, even after their health plan said no. So sometimes we're going to file a consumer complaint with DMHC. If we are having delays, you have a problem getting appointments, getting referrals, getting authorization, it's going to take 2 months before you can see a doctor you need to see, or there's not a doctor that of the kind you need to see in your area. You have billing issues, you have problems with translation services or finding a doctor, complaints about your doctor or plan, okay? Things like that, those are ripe for complaints to DMHC, and DMHC can help us figure out how to get you what you need. But back to that independent medical review, which is a nice tool that we have in our tool chest. We can request that on your behalf or help you request it. If your health plan basically says, yeah, we know your doctor says you need this, but we don't think so, and we're not going to cover it. We have the ability to ask DMHC for this independent medical review, where doctors who are not part of your health plan look at your records, look at what's been recommended and why, and they give you a decision about whether or not your plan will have to cover it. And if DMHC says your plan has to cover it, then they do. So anytime you've been denied a service, within 6 months of that denial, we can ask for this independent medical review. We have clients sometimes who call and they say, well, I saw this presentation and it said 6 months, but it's been a year since I was told I couldn't have this surgery that I need on my knee. Is there anything you can do? Yes, there is. Because it's 6 months from the denial, but just because your health plan denied it a year ago as opposed to 6 months ago, doesn't mean we can't go back to your doctor and say, hey, client's doctor, this person, do they still need this knee surgery? And the doctor says yes. And we say, well, would you request it again? And they request it, and you get a new denial, and now it's not more than 6 months old. So don't worry about how old that denial is if that's an issue you need us to help you with, because there are ways to work with you on that. Okay, so in most cases, an IMR is going to be done within 45 days. There are ways we can ask for it to be done a little faster than that, but it's not usually something we use for our urgent issues. It can be expedited. And if it doesn't meet the criteria for an IMR, okay, if you're just not sure, is it really something I need an IMR, and DMHC looks at it, then they can just process it as a complaint. You don't have to worry about whether to submit it or not. Okay, so I'm going to leave this one up for just a second. This is the number and the website for the DMHC Help Center. This is how you reach them directly, but if you need their help, you also can always call us. Okay, I want to move on and talk a little bit. Actually, before I do that, I want to ask Andy or Jennifer if there are any questions so far that relate to what I've presented that I need to answer before I go on.
I don't have any yet in the Zoom chat, but this is a good opportunity to remind everybody that if you do have any questions, to go ahead and post those in the Zoom chat. And when Brandi has a moment, we'll take those questions. And towards the end, we'll have a Q&A as well. I did also post the phone number for the CCLS Legal Advice and Referral Line. And that is the 1-800-675-8001. It's also at the bottom of the slides. And note that there is an extension for the health department if you're calling with health-related issues, and that extension is 1271, and that's at the bottom of the slide. Jennifer, how are things going on Facebook?
I don't have any questions yet.
Okay. Thank you. I just want to make sure that I pause often enough that if there's a question related to something I've just said, we can stay in the moment as much as possible. So I'm going to move on, and I'm going to talk about things that are directly related to accessing care during the public health emergency for COVID-19. This is just my disclaimer. Basically, we know that this situation is changing, and it's changing rapidly, and it's changing frequently. And we get new information sometimes daily. So the information I'm giving you today about what's available is accurate today. It's probably accurate tomorrow. Beyond that, you may have to call us. If you try to contact someone I've listed here and it's not working out for you, that's okay, call us, we'll help you. We get information very, very frequently, new information, and we are happy to pass it on to you, but we only have so many ways we can do that. So if you can't find the resource you need with this information, that is totally okay. We're happy to hear from you. Okay, the first thing I want to talk about is getting tested. A lot of people are seeing problems or difficulty in finding a test. There's a shortage of available testing and testing sites, and finding a test can change daily. We get flyers that say, hey, there's going to be a drive-through test site today only. That's wonderful. Can you plan ahead for that? Not so much. So these are some ways to find tests. You can always, like I said, call us for up-to-the-day information. We'll tell you whatever we know today. But these are some general things to start with. So California's Project Verily with OptumServe has testing sites. These are the drive-through testing sites that are being run by the state. And you can go to the state's website to find the one nearest you and register. That's at covid19.ca.gov. And that website, the testing and treatment is where you want to go if you want testing, but there's also just a wealth of information on that website about what we know, the statistics, how many cases there are, the best information we have right now about spread, about preventing spread, about taking care of yourself and your family. So it's a really good all-purpose website. That testing and treatment area is where you want to go to register for testing and find out where the closest place to you is to do it. If your insurance covers an urgent care, you can always call to find out if they have tests or if they have a recommendation for where you should go for testing if they don't. A lot of urgent cares do have tests, and even some that we've seen where we find out one week, hey, they're out of tests, then the next week they have some. So it's always good to check if you know that you're covered for urgent care. We are also seeing some community drive-through testing. These are the ones that we are seeing on the news sometimes. You'll see, hey, there's going to be a testing site in Fresno County tomorrow through Monday, or in Visalia for these dates. Watch for those, because they are often, if there happens to be one at the right time, the fastest way to get a test. If you're experiencing severe symptoms, and again, this is not medical advice, this is just a way to get a test. If you're experiencing severe symptoms, go to the emergency room. Okay, they do have tests and they can treat you for whatever symptoms you're having. Most insurance is covering COVID-19 testing where it's medically necessary. And if it's medically necessary, it's being offered free if you're uninsured. There have been some glitches here and some problems people are seeing. So if you see a problem with this where it's not being covered, call us. We can help you figure that out. One thing that we're seeing, excuse me, one thing we are seeing is that people are being told if they don't have symptoms, their testing is not medically necessary, and that's why it's not being covered. There may be other reasons that your testing could be medically necessary based on who's in your household, or if someone else is sick, or if you have underlying conditions. So if that's a concern that you have, call us and we'll help you figure out if you're eligible for testing without cost and how to get it. Okay. What if, maybe it's related to COVID-19 and maybe it's not, you need access to urgent care. That level in between, I don't have time to wait for my regular doctor, but maybe I don't quite need to go to the emergency department, as determined by you, of course. Some of these urgent care centers are closed right now, and some of them, because some are closed, others are just overwhelmed with patients. So it can be really difficult to get in to be seen, and especially if you have symptoms that might be related to COVID-19, they might tell you, oh, no, you need to go somewhere else, or you need to go to the emergency department. So you can call the number, if you have an insurance card, call the number on the back of it and ask, what are my urgent care options? The urgent care that I usually go to is closed or cannot see me until next week, or whatever the case is. Where can I go for urgent care? And they have that information, and if they don't have that information, then they're going to tell you exactly what I'm about to tell you. You can go to the emergency room. If it is urgent and you're experiencing symptoms and you need immediate help and you can't get into urgent care, you can go to the emergency room. Now, what if it's not an emergency? What if I'm sick? I have a stomach bug, or I have some medical issue that is just not an emergency, or I need my medications renewed, and it's just a routine visit. I need a physical. It's time. Hey, start by calling your regular doctor and ask for an appointment. A lot of doctors, we're hearing, oh, doctors aren't seeing patients, but a lot of doctors actually are. If you call and you can't get an appointment, then again, you have that number on the back of your insurance card. It's their job to tell you where you can find a provider who can see you. But also consider telehealth appointments, which we're going to talk about some more in a minute. These are sort of becoming a bigger thing here out of necessity. And also they're really good options. They keep you safe. You stay home, you see the doctor, you have that option in a lot of cases, but we'll come back to that. If your regular doctor is seeing patients, keep in mind, they are still going to have you follow certain precautions. They might want to check your temperature before you go in. They probably want you to wear a mask. They'll probably have you distance while you're there. And they'll tell you what the procedure is when you go in. Make sure you follow those, because that's going to have a big impact on whether you have the ability to access care. Okay, if you just can't see a doctor in your regular practice and you're not sure where else to go, our community medical clinics are open throughout the Central Valley and seeing patients. Okay, you want to make sure you call first to find out if they can see you, if they can see you by telehealth, what precautions you need to take if you go into the clinic. And our community medical clinics and partners, they exist to fill a need, and they are sliding scale for based on your income and your household size. Okay, and I'm going to come back to those in a minute also, because we have a list for you to start with. So telehealth and virtual health appointments, like I said, these are becoming a much bigger thing. Healthcare providers are using the available technology to see patients either on the phone or over the internet. And a lot of us kind of think, well, that can't possibly be as good, right? Don't be afraid of it. Don't throw it away out of hand. It keeps you safe while you get the health you need, and most insurance is covering it at the same rate as an office visit. Okay, it can be used for medical appointments. Some things, sure, your doctor is going to say, I'm sorry, I have to look at that. I have to see you. I have to do some tests. But some things, like let's say I need to get my medications renewed and it's just time. Okay, I can do that by a telehealth appointment, and I can say, hey, my symptoms haven't changed, or here's how they've changed. And this is all I want is to renew my medications. And my doctor can say, okay, it sounds like your symptoms haven't changed. We'll just renew your meds. Great, right? I stayed home, I stayed safe, I got what I needed. And if I'm really lucky, I can order my medications through the mail, and I don't have to go anywhere to get them. Okay. Telehealth can also be used for mental health appointments, and they can even be, telehealth appointments can even be used for some dental appointments. Obviously, if you need work done, they can't do that over the internet yet. We haven't figured that one out. But some things, that, and certainly an initial evaluation, can be done by telehealth, and providers are doing this. So if you call to make an appointment and your provider doesn't mention telehealth, ask about it. It may be they didn't mention it to you because what you need doesn't work over telehealth, but it also may be that you asked for an appointment, they thought you wanted an in-person appointment. So make sure you ask for that if you're open to it. It is really much safer right now. Moving to dental care. And this has been an interesting one, and we've seen a lot of new callers who are trying to access dental care. A lot of dentists are only seeing patients for dental emergencies. So if you need to see a dentist for a non-emergency, call and ask, when can you see me? Do you recommend somebody else who will see me? I need a cleaning. I need my braces adjusted. I need whatever non-emergency thing that you need. If you have dental insurance, again, you've got a card. Call the insurance and ask for a provider who will see you. My regular dentist, Dr. Smith, is only seeing emergencies. I don't have an emergency, but I can't wait forever on this. I need to go in. Who can I go see? A dental emergency, though, and this is something we're seeing more and more lately, is someone who calls and says, my dentist is only seeing emergencies and I don't have an emergency. I'm just in a lot of pain. That's a dental emergency. Okay, a dental emergency does not have to be a life-threatening situation. If you're hurting, if you're having trouble eating because of something that's going on in your mouth, if you have some kind of swelling or abscess that might be an infection, those are dental emergencies. It is okay to call your dentist and say, I am having a dental emergency and I need to be seen for it. Okay. Going back to what I mentioned earlier, our community health partners and community medical clinics. Okay, I've got a partial list here. There are more than this. These are the ones that are in our sort of central service counties and that we see our clients using a lot. If you don't see one here listed in your county or in your area, or you need other help on this, that's okay. Again, give us a call. Okay, United Health Centers of the San Joaquin Valley and Clinica Sierra Vista, are large providers. They're sliding scale based on income. They're going to ask you for information about your income and your household size to determine what that sliding scale should look like. Both of those are doing telehealth appointments or traditional appointments, depending on what you need. Okay, so if you need something that really requires you to be there in person, they're going to want to do a health screening and make sure that you don't have symptoms of COVID-19. And that they're going to want you to wear a mask and to take proper precautions when you go in, but they are doing in-person appointments. They're also doing those telehealth appointments. So if you can't be seen for some reason, or you just don't want to be seen in person, then a telehealth appointment is available to you. And if you don't need to be seen in person, they may even say, hey, we would really prefer that you do a telehealth appointment. So keep that in mind. Family Health Care Network is offering telehealth appointments, and they're doing medical, dental, and behavioral and mental health, traditional appointments when it's needed, sliding scale, and I've got the numbers listed there both for Fresno County and for Tulare and Kings counties. Castle Family Health Centers have several offices in Merced County. They're doing both telehealth appointments and traditional appointments, and their number is there, and so is their website. I know I'm going through this stuff kind of fast. This video is going to be posted on our Facebook page. So if I go too fast and you don't get a number or you don't get a website or anything, go back and look at the video, scroll through it, or again, just call us. We have the information and can give it to you that way as well. Livingston Community Health, also in Merced County. They're doing telehealth appointments for medical, dental, and behavioral mental health. They're doing traditional appointments when you need it, and their number is there as well as their website. Camarena Health in Madera County. They have also testing for COVID-19, and they have telehealth and virtual appointments as well as traditional appointments if needed. And their phone number and their website are listed there. Okay. And this is what I told you just a moment ago. If we haven't listed someone here, it doesn't mean there's not one in your county or near you. It just means I didn't list it. So you can call us, or you can call the Health Consumer Alliance, and their number is there. And they can tell you in any county where you can go for a community health partner, community medical clinic. Okay. So if you keep nothing else from this entire presentation, our number there at the very bottom of the slide, and the HCA number here in the middle of the slide. Okay. Here's how you can reach us. This is the main number for CCLS, and then if you want to get health directly, you can dial the extension 1271, and that takes you directly to health. Here's what happens when you call us. Okay, you're going to connect with our intake specialists, and they're going to get some initial information about what your problem is and what your situation is, what your circumstances are, what you need from us. And they're going to take that initial information, and then your case is going to be assigned to one of us, an advocate, who takes a look at it and says, okay, here's what I can do, here's what I need in terms of more information, and then we'll contact you, the advocate will, and say, hi, I'm your advocate, and we take it from there. So it is not always the case that you will immediately talk to an advocate. You're going to go to our intake specialist first, but we'll get back to you as fast as we can. And we are always looking for our intake specialists are wonderful, because if you need immediate assistance, they flag that. This is something that is urgent. So we make sure to call you back as promptly as possible. Okay, so this is our website, centralcallegal.org. You can also follow us on Facebook. Like I said, this video is on Facebook, so are all of our others. Our previous clinic on medical debt and how to handle that is on there. And CCLS also has wonderful videos on that Facebook page from our other groups in CCLS, domestic violence, workers' comp, wonderful information that you may need. Take a look at those videos and see if that's helpful to you. If you have the means and the inclination, this is always a good time to donate to CCLS, and that's available on our website as well. And I'm going to thank you now for attending or for watching on video later, if that's the case. But I'm also going to thank you again after we go through questions. But I really appreciate participation. We're trying to reach as many people as we possibly can and be everywhere. And it is a work in progress. How about questions? We have questions, Andy?
Wonderful. Well, thank you, Brandi. That was excellent information. So I'll start with the Zoom chat, and then I'll let Jennifer chime in with some questions on Facebook Live. We do have a comment rather than a question in the Zoom chat, and one of the attendees posted the comment that it is mandated in the state of California for COVID testing to be free with no cost sharing regardless of insurance status. Check the insurance commissioner's website for more information.
That is accurate. We are seeing people have trouble enforcing that. And so that's what I want to raise is that we are seeing people being told, no, we're not going to cover it if it's not medically necessary, or being charged for it. It is improper. That's exactly right. But you may need to call us to help work it out.
So thank you to the attendee that posted that in the Zoom chat. And then if anybody else has questions or comments, feel free to post them in the Zoom chat. And Jennifer, do you want to let us know if we have some questions on Facebook Live?
Yeah, we have a few on Facebook. Can you help me even though I'm undocumented? And can you keep my undocumented status confidential?
So we do not have the ability to help someone who is undocumented, but we have a lot of community partners who can. So you are still very welcome. Please call us and let us help direct you in the right direction for someone who can help you. And we do not have any obligation and take no obligation upon ourselves to report anyone's documentation status or immigration status. That's confidential when you call us, as is everything else you tell us.
And the next one. Can I call you for somebody else? Example, my child or my parent?
So I'm going to tell you the lawyer's favorite phrase, it depends. If your child is a minor, then yes, you as their parent can call us as the primary client. We know that we're doing something for your child, but you're going to be our contact person. For anyone you have a power of attorney over, you can call us and we will help with you as the point of contact for that person. Where it can sometimes be a little bit grayer is if you call us, hey, my mom needs this. We need your mom's agreement if you don't have a power of attorney, both that your mom wants this help and that she's okay with us talking to you as the point of contact. So it depends, but yes, call us and we'll tell you what we need to be able to help.
I want to get a COVID test, but my insurance won't cover it because I don't have any symptoms. Can you help me?
Yes. So as we talked about a moment ago, COVID testing is supposed to be covered. It is right now, I think we're seeing maybe some rationing of testing. I hate to use the word rationing because I'm not sure it's that deliberate. But we are seeing people being told, oh, you can't get a test covered right now because you don't have symptoms. Symptoms are not the only thing that would make a test medically necessary. So we very well may be able to help you get that. I hope we can help you get that. So give us a call and we'll figure out what the circumstances are and how to get you tested.
I was in the middle of getting some kind of treatment when my doctor's office closed for COVID. What should I do?
Okay, that's actually something we've seen a few times and can be a little bit complicated. Maybe you were getting some kind of regular, I don't know, iron infusions or some kind of treatment that you were getting periodically or had begun treatment, and your doctor's office closed in March or in April, and now you know, okay, now what? What do I do? I've stopped treatment because I can't go to my doctor. So where am I going to go? What am I going to do? So again, that number on the back of your insurance card can be really useful. So can calling your doctor's office and saying, what exactly am I supposed to do? They may have an option. They may think you're going to call and you're going to ask, and I'm going to send you to Dr. Smith, who is doing this. So there are options. If none of that works for you, though, again, call us. Sometimes we can help figure out that sort of thing. We are not seeing a whole lot of situations where we can't find a way for you to continue the treatment, particularly where it is some kind of very serious treatment that you need. You know, if you were having your teeth whitened and you had 2 visits done and you needed 2 more, we might or might not be able to get you in right away for that. But anything that impacts your health, hopefully we can help you find a way.
I have a medical issue and I need treatment, but my provider says it isn't an emergency, even though it feels like one to me.
Okay. Yeah. So a lot of things can feel urgent. They're impacting our health, and our health is important to us, especially right now. So it feels like an emergency, but your doctor says that's not really an emergency. There's that gray area again of urgency versus emergency, but it all comes down to what we call medical necessity. If it is necessary for your health, there is a way to get your insurance to cover it, and your insurance plan has to give us a provider who will do it for you. So that may come down to you needing someone to advocate for you to say, yeah, okay, well, I'm not bleeding to death, but it's still important, and get that done for you. So please call us.
And this last question I have, I'm worried about whether my family member in a long-term care facility is getting the therapy or treatment they need because I can't visit them. What should I do?
That's a really valid concern. There are scary things happening that we're hearing about, horror stories in long-term care facilities. Most are not the worst case scenario. But since you can't go in and visit on a regular basis, it can be really concerning. You know, my mom is in a care home, is in a long-term care facility or nursing home, and I'm not sure because she can't really communicate with me well that she's getting her physical therapy or her mental health therapy. I can't tell if she's, you know, being treated well, if she's getting everything that she needs. Your first point of contact obviously is the facility if you're not getting the information or can't for some reason get the information from the patient. And sometimes we get information from the patient, but maybe we're thinking, you know, mom's telling me everything's fine when it's not. So your first point of contact is the facility, but also the county's long-term care ombudsman can be a help. They're a liaison who can contact the facility and get better information sometimes than we can. And if you need an advocate for your loved one who's in a long-term care facility, or you just need an advocate to find out if they're getting what they need, again, call us. We do have experience with that. It can be a really difficult situation because we know that our healthcare providers in long-term care facilities are overwhelmed, and they're, for the most part, trying to do what they need to do for patients, but they also count on family members being able to help most of the time. And so it can be a little bit of a tightrope to walk, and we are happy to help you advocate for your loved one that way.
Those are all the questions I have from Facebook.
Okay.
All right,
Thank
thanks,
you.
Jennifer. We do have a question on in the Zoom chat about COVID testing, and the question is, how long does it usually take to get the results from a test, and should I get tested only if I feel sick?
So I'm not going to tell you if you when you should get tested. I think that's medical advice, and just as an individual person, I'm hearing conflicting information about that anyway. I think we're hearing that there are reasons to get tested even if you're not sick, because you might be in a position to expose others, things like that. But that is definitely a question for your doctor. How long it takes, unfortunately, we are seeing everything from a 2-day turnaround to 6 to 10-day turnaround. I think that there are differences in the labs that are processing the test. I think there are differences depending on if you get tested in the emergency room and they push it through as urgent versus in a drive-through test where it may not be treated as urgent. I really don't know. We're seeing a huge range. So I wish I had a better answer for you about that. I will say, and again, not medical advice, just sort of a I don't know, public service sort of announcement, that we are hearing from some people that their provider, when they test, doesn't tell them that they should quarantine until they have results. And so what we know is if you have to wait a week to get a test and then you have to wait a week to get results, if you're not doing your best to self-quarantine in the meantime and you're positive, you could be in contact with a lot of people in that time.
Fantastic. Thanks, Brandi. Well, that appears to be all the questions that we have on Facebook Live and all the questions that we have in the Zoom chat. Do you have any other thoughts before we close out, Brandi?
I want to say thank you again, especially for the questions. I appreciate that and being able to add information. And I also want to say, if you need or you know someone who needs the same information in Spanish, my colleague David Yanez is going to be here in same space on Facebook Live tomorrow at noon with the same information, but with, extra flair.
Yeah, thank you for reminding everybody of that. That will be broadcasted at noon tomorrow, and that will be a similar presentation to this, as Brandi mentioned, in Spanish. And Jennifer will be hosting that. And so you can watch that on Facebook Live if you just keep an eye on our Facebook page. There also is a Zoom link that should be posted on Facebook as well if you want to attend in the Zoom meeting. So spread the word about that if you have an opportunity. Last, I just wanted to thank everybody for attending today. I hope you found this information valuable. Thank you very much to Jennifer for helping to present and the Facebook Live feed. And Brandi, thank you very much for providing all of this wonderful information to our clients in our community. So that's all we have for today. Please do call CCLS if you have a legal issue or need help. And with that, have a fantastic rest of your day.
Thanks very much.
Bye, everybody.